This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Breast milk is the best gift a mother can give to her baby.
There are a lot of advantages for breastfeeding, both for the baby and for the mommy. For the baby, basically the breast milk is a complete meal. So the breast milk is full of nutrients that the baby needs, at least for the first 6 months of life. Because during the first 6 months, breast milk is the only thing that is given to the baby.
Sadly, not all mothers are capable of breastfeeding. Cheryl Bernabe Navarro, a first-time mother to Emerald, knows that her own milk is the best for her baby.
Number one, according to my pedia breastfeeding not only bond the mother and the child, but most especially yung giving breastfeeding to your child, it gives the nutrients and antibodies to protect the babies.
Breast milk contains all vital nutrients that a baby needs and antibodies that help them fight diseases.
There are a lot of antibodies present in the breast milk. So it protects the baby from certain infectious diseases, very commonly diarrhea.
But inasmuch as Cheryl wants to breastfeed, she is having a hard time in doing so.
I have the breast milk naman after 2 days or 3 days, kaya lang sobrang konting-konti talaga.
Determined to give her child only the best, Cheryl sought help from Human Milk for Human Baby. Cheryl hopes that one day she'll be able to give Emerald enough milk, but while waiting, she will do what a mother should do.
Actually, I'm still hoping na magkaroon pa rin ako ng breast milk kasi parang aside from the donations we have, I can't imagine na pag yung baby ko lumabas na from the ICU na I cannot supply breast milk and then just settled for infant formula.
What are the benefits of breastfeeding? What should new mothers with insufficient breast milk supply do? What are the proper positions for breastfeeding? All these and more tonight on MedTalk.
Joining us tonight is Dr. Cristina Cornelio Bernardo, lactation consultant and chairman of the Breastfeeding Committee of the Philippine Pediatric Society. Also joining us is Dr. Rachel Saban-Lilin, pediatrician and lactation counselor from the Makati Medical Center. Good evening, doctors. Welcome to the show.
Hi.
August is Breastfeeding Month.
Yes.
And
Yes,
how do we
it is.
celebrate Breastfeeding Month?
Well, for pediatricians and for pediatricians in the hospital, we usually celebrate it. We try to make it a coordinated celebration with each hospital, especially for PPS accredited hospitals. So we follow the World Breastfeeding Alliance for Action, and this is every August 1 to 7, the first week of August, and we try to create awareness to the public.
You mentioned awareness, and here on MedTalk, we would always want to create awareness and educate our viewers. Now with breastfeeding, so what is the importance of breastfeeding once young or their babies?
There are a lot of benefits that both the baby and the mother can get from breastfeeding. For one, as was mentioned, the baby can get a lot of protection from diseases by breastfeeding alone. And then the mother also, they've seen that there's a decreased incidence of ovarian and breast cancer when they breastfeed their babies. So there's that benefit.
aside from the benefits to the infant and the mother, as a society, it also decreases infant mortality rates. So we are all pushing for the Millennium Development Goal 4 and 5, which decreases infant mortality and morbidity rates. So it's by 2015. And breastfeeding is the single most cost-effective way of reducing that.
And you mentioned also the benefits. Let's
Yeah.
talk about the benefits of breastfeeding for the mother first.
Like we said, there are illnesses that you prevent,
Like
cancer for one. That's a big, if you're able to prevent breast cancer and ovarian cancer, that's a very big plus for the mom. Also, breastfeeding releases oxytocin in the mother, and this helps you to actually fight stress. It helps you fight stress, so that's a good thing.
Yes.
So they find that the mothers are less prone to depression when they breastfeed their babies.
Really?
Yeah.
Wow, okay.
And you're aware about postpartum depression,
Yes,
that
yes,
can
I
happen,
am.
right? But when you breastfeed your baby, supposedly it helps
Okay.
to prevent that.
And the oxytocin also helps involute the uterus, so it makes the stomach of the mother smaller, and then helps with weight loss.
Yes.
So yeah, they go to their pre-pregnancy weight earlier.
Because of breastfeeding.
Because of breastfeeding,
Yeah.
they lose 500 kilocalories per day just by breastfeeding.
These are the benefits, the health benefits that,
To the mother.
to the mother.
To the
How
mother.
about
To the mother.
The health benefits to the infant.
The babies, of course, are protected from illnesses like respiratory illnesses, the common cough and cold, and then gastrointestinal. So there's less incidence of diarrhea in these cases. And if you have a baby who's prone to allergies, breastfeeding is actually best for them because it helps to prevent allergies in babies.
And then what we usually, because I think most mothers, they know the benefits, but some, they still prefer not to breastfeed. So what we usually tell our patients is the risk of not breastfeeding. So we tell them, we put it in such a way that we tell them if you don't breastfeed, you might have diarrhea. This reduces diarrhea by so much percent. Like for allergies and asthma, it reduces by 40%. So, and then it's also dose dependent. So if you don't just breastfeed for 1 month, you want to breastfeed exclusively for 6 months. If you breastfeed for just 2 months, you don't get the benefit for the 6 months. So 6 months, if you exclusively breastfeed, this protects you from leukemia and lymphoma. So if you just breastfeed for 4 months, you just get the protection from allergies and asthma.
But if you prolong it,
More protection.
More protection for more severe illnesses, in fact. Even diabetes,
Correct.
right?
Obesity.
Yeah. Obesity and eventually hypertension, cardiovascular disease.
what is it in the mother's breast milk that can prevent all these from happening to the individual?
The antibodies, the white cells, the hormones, the enzymes, all these things cannot be manufactured. These can only be produced by the human body. Yeah.
So that's the difference between the breast milk and milk formula, the immunoprotective factors.
Okay. That the mother produces.
Yes.
And that she passes on to
To
her
her
baby.
baby.
But like a first-time mom, I'm sure all first-time moms, are still unaware or still very hesitant to breastfeed, maybe because of the fear that they might not be able to do it right, or that the baby might not get enough nutrients. How do you encourage all these mothers to do so?
Well, usually the issues with first-time mothers is they think that it's automatic to just, when you give birth, the milk is right there right away, and then you can just latch on your baby. What they don't know, it takes time and practice to latch on a baby, especially those first few days. It's natural for babies to suck, but they need a little help with the latching on. So before you get discharged from the hospital, we want pediatricians and the nurses to really help support the mothers learn the latch on and positioning techniques.
You mentioned exactly the thing that, that makes breastfeeding not successful, the unawareness. But if you're able to arm them with the knowledge, then it makes things easier from then on.
It makes it a pleasant experience for the mommy and for the baby.
So it's important to really tell them what to expect, the difficulties that they may encounter, and when they, with that, they should be able to breastfeed successfully already.
Okay, we talk about successful breastfeeding. We now have a video on learning how to breastfeed. Maybe we can show that video now. So breastfeed holds, the different positions in which the mother can help her baby latch on to her breast. So, doctors?
So the mother here is holding the baby in the cradle hold. That means that the baby's head is at the crook. It was at the crook of her elbow. Now she's gone to the, there, that's the cradle hold, okay, where she's supporting the head, the back, all the way down to the butt of the baby. That's the cradle hold. All right, and then,
is this an instinct, the cradle hold?
that's the more common hold, yes.
But the position that we teach is actually for pediatricians, the cross cradle hold, because you have a free hand to position your breast. But it's very natural to use the cradle hold.
The cradle hold.
Okay, maybe we can take a look at the video again.
The difference is the reverse cradle hold, the baby's head is now opposite from the crook of the mom's elbow. Instead, she's holding the head with her hand, still supporting the back all the way to the butt. So now if you'll notice, her left hand is free there to arrange, to hold her breast and as well as arrange the baby's head there.
Okay, so it's important to hold the head and the butt to support.
To support the entire body, yes.
Okay. So those are two, the cradle and the cross.
Holds, yes.
Cross cradle.
And then there's a third one, which I believe they're going to show.
Okay.
This is the football hold. This is usually done by mothers, by big-breasted mothers with small babies. Yeah, they find that this hold is easier. Or for cesarean section also, yeah, they do this hold also, so that the baby's away from the incision there.
There you
go.
That's
the football hold, where you hold the baby like a football.
Okay.
But the position that I really like to teach new moms is the lying down or side lying position. There, this one. I like teaching this because moms like to lie down a lot after they've given birth, right? And in this position, both baby and mom are safe, even if they both fall asleep, and it's very comfortable. It makes night feeds really successful because you don't have to get up anymore to feed your baby. You just have to roll over on your side. And if you're successful with your night feeds, that really increases your milk supply.
So we've shown all the different positions for successful breastfeeding. Other babies who are not yet, who don't have control, who cannot latch onto that breast, tend to latch onto the nipple, which makes it very uncomfortable for the mother. And they think that, very painful, and they think that they don't have enough milk or that the baby is not getting their milk properly. What can you say about that?
That should signal the doctor. If the mom says that if there's pain all throughout the breastfeeding, then you have to check the latch. The possibility is that the baby's just holding on to the nipple and not getting enough milk, right? And then the tendency for the baby who's getting not enough milk is to stay on the nipple, on the breast longer than usual, and that's also very uncomfortable. So we teach them how to do it properly. We tell them how to help the baby open their mouths wide so that it can accommodate as much of the breast tissue inside the mouth for more effective breastfeeding. That we teach that when we do lactation counseling.
Do you stimulate, does the mother have to stimulate the mouth of the baby by touching it maybe or making it
just the upper lip, no? The upper lip. If there's a reflex for them to open their mouth, and then you just make sure that they get most of the breast tissue and not just the nipple itself. So it's really the lower lip that strips the milk, no? That strips the milk. So the upper lip is just there to latch on to hold on to the nipple, but it's the lower lip that massages the breast. So when you check for the breastfeeding of the mother, you have to make sure that there's the sucking and the milk transfer is good. Also.
So we mentioned the benefits and the importance of breastfeeding. When we come back, we'll be talking about the common challenges that mothers face when breastfeeding. MedTalk will be right back.
Did you know that human milk is sold on the internet for $4 per ounce? That's about 262 times the price of oil. On one classified advertising site, there are more than 20 milk sellers online. Shipping costs are inclusive in the purchase, and overnight shipping is often available for mothers who need milk immediately.
We're back here on MedTalk, still celebrating Breastfeeding Month. Now we'll be talking about the challenges and the barriers, the common challenges that mothers face when breastfeeding. Okay.
The very common challenge that I find with first-time moms especially is that as soon as they give birth, they expect there to be a whole lot of milk already, you know? They've seen other mothers and they see how they breastfeed and the milk is actually spurting out already, and they expect the same thing from themselves. What they don't realize is that it's not going to be like that in the beginning. In fact, for the first 3 to 5 days, it's possible that they're not going to see their milk at all. Okay? But just because they don't see their milk, it doesn't mean that their baby's not getting anything. So that's something that I have to explain to the moms. You're not starving them as long as they're latching on, they're latched correctly, and they're sucking from you, then they are getting milk.
Okay.
Yeah, even if you don't see your milk.
There's something that's still being produced. There's something that's still coming out.
I tell them no matter how you pinch breast or squeeze your breast, you're not going to make it come out. Only your baby will be able to make that milk come out.
Okay.
Yeah.
All right. Why is it just the baby?
Because of the stimulation, only the baby can release these hormones in the mom, which starts the whole lactogenesis or the production of milk.
And then once the baby has started that lactogenesis, tuloy-tuloy na.
Yeah.
So what they don't know is the first few days, the first 3 days, that's when the prolactin hormone is highest. So it's like just you're phoning in your orders already. So if you just keep on latching and latching, there's no delay in the lactogenesis. Your mature milk or your copious milk supply, or what we call the mature milk. So the misconception is they're waiting for the mature milk, the white milk, but the first 3 days we just have the colostrum. Very few drops to 1 teaspoon for the first 24 hours, and
Which
that's
is
enough.
Far more important, and it's very important. Okay. Far more important than mature milk at that time.
So the first 3 days, it's actually they need protection more than the nutrition for the first 3 days.
What does the baby get out of the colostrum from the mom in the first 3 to 5 days?
A lot of protection from infections. You have to remember that they came from a very sterile environment inside the stomach, and then when you bring them out, you know, all of a sudden it's non-sterile. So you're providing them with protection from all the viruses and bacteria by breastfeeding them.
So if you measure it, the immunoprotective factor is about 11,000. For a mature milk, you just have 1 to 2,000. For a milk formula, it's 0.
Okay.
So you see the difference between the colostrum, which we call the liquid gold.
So this is like a first challenge. For the first few days of life for the baby. And then as the mother breastfeeds, she may encounter other challenges like maybe sore nipples or maybe the ducts are not, how do you say that?
Plugged.
Plugged up.
Well, that's not very common. It does happen, but there are ways that we can fix that. But it'd be kind of technical to go into.
Okay. But it can be fixed.
It can be fixed,
okay.
Yes. Yeah.
So normally for the challenges that we have, the sore nipples, engorgement, adenitis, mastitis, all of these are actually preventable. So prevention is the key. So we have to make sure as health professionals that our mothers leave the hospital knowing how to latch on properly, because this prevents sore nipples. This prevents
sore nipples and mastitis.
But this is normal. This normally occurs to mothers while breastfeeding.
It can happen, yes. Yeah.
Okay, all right. Doctors, we'll go to our Facebook question. Is there a way to increase milk supply? What food can I eat to increase my milk?
What you should remember is that breasts work on the law of supply and demand, okay? So if there's more demand, there'll also be more supply. So if you're able to breastfeed your baby more often, then you will also produce more milk. And what I like to tell my patients is if you pump your breast, you also fool your breasts into thinking that all that you're pumping is being consumed by the baby. So you're also able to produce more milk if you pump your breasts.
Okay. Yeah. And there are 3 ways to pump.
The different kind of pumps.
Yes,
There's some. You can use your hands for pumping. You can also use the breast. Hand expression. And then there's also different breast pump. There's a manual breast pump and a electric breast pump. Yeah, it's different for different mothers. Some like it. Some like doing hand expression. It's more comfortable for them. Some like to be able to do other things while they're pumping their breast, so they like the electric pump. So it's different for different moms.
Thank you, doctor. Our next question is from Twitter. Is it safe to get breast milk from other mothers?
Actually, this is very controversial. No? So we just had our breastfeeding congress. August 1 and 2, and this is actually the question that we've had, and we had a lot of exchanges from the neonatologists, from the pediatric infectious. So right now, as again we were saying, as a health professional, right now our stand is we do not advocate for informal milk sharing at this moment, but we are still waiting for the national guidelines. It's there, but we should to undergo training for that. So maybe relatives, maybe
like
sisters.
Maybe if it's your own sister and you know more or less the health picture of your sister, then there shouldn't be anything wrong with that. But a complete stranger who you're not exactly sure what their health status is, then no, it might not be a good idea.
What would you want them to do is, if they want milk, they can get it from a milk bank. Human Milk Bank, we do a verbal screening, check for high-risk patients, and then they screen serum, they check for CMV, syphilis, HIV, and hepatitis B, and then they pasteurize this. So as health professionals, this is what we want our patients to know, that if you want some breast milk,
there's the milk back to turn.
I think because of that question, it brings us to the discussion that maybe some mothers do not have enough breast milk, which leads them to a milk bank, or to get it from someone else. So how come other mothers may not have enough breast milk? What could be the cause of this?
It could actually be a misconception, because like I said, if they don't see it, they think they don't have enough. So you have to equip them with the knowledge. How do you know that your baby's getting enough? We tell them to count the number of wet diapers, how many urine output, and how many bowel movements. And we have a number for that. Like for the first day, it's 1 urine, 1 bowel movement. For the second day, it's 2 urine outputs and 2 bowel movements. So if they know this, despite the fact that they cannot see their milk, then they know, okay, it's not coming from anywhere else. My baby's pooping, so it must be coming from me. There.
Okay, well, that's a very good tip. And because you can't see the milk, then you can see when it comes out.
Yeah, when it comes out.
When it comes out, yes. So doctors, does it necessarily follow that if a mother has larger breasts or small breasts, that the milk supply would be enough or would be little?
Whether you're large-breasted or small-breasted, I exclusively breastfed my 2 children. So it's actually more of frequency. For example, a large-breasted woman, when she breastfeeds, the frequency and interval is every 4 hours. When I will just have to breastfeed more
More
frequent,
often,
so more
yeah.
often, so every 2 hours. So, but at the end of the day, we can actually produce the same amount of milk.
So no, the size of the breast is not going to affect
The
breast
supply
milk.
of
Yes,
the milk.
yes.
Doctors, we're out of time. Any last message to our new mothers, to our expectant moms, and to those who are still currently breastfeeding?
Breast milk is really the best way to start your children, you know. And we're not, later on in life, you'll see that there are so many things that's best for them, but sometimes they're not affordable. But here, your breast milk is something that's yours to give, so why not give it to your baby?
Thank you. Doctor?
We were discussing earlier that I wanted to talk about the barriers of successful breastfeeding. Well, first of all, for all new mothers, we want you to get your prenatal education while you're still pregnant, to get all this knowledge and practical skills. And second, to make sure that your hospital, you also choose your hospital. They should be baby friendly because there's a lot of disruption. The hospital policies and practices can be a barrier to successful breastfeeding. And also choose your pediatrician that can support you with your breastfeeding plan.
Okay. Thank you very much, doctors. Again, I'd like to thank Dr. Bernardo and Dr. Lilin for joining us tonight in our breastfeeding discussion. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on Solar News Channel. This is Angel Jacob. Good night. This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
I'm still hoping na magkaroon pa rin ako ng breast milk kasi parang aside from the donations we have, I can't imagine na pag yung baby ko lumabas na from the ICU na I cannot supply breast milk and then just settled for infant formula.
What are the benefits of breastfeeding? What should new mothers with insufficient breast milk supply do? What are the proper positions for breastfeeding? All these and more tonight on MedTalk.
Joining us tonight is Dr. Cristina Cornelio Bernardo, lactation consultant and chairman of the Breastfeeding Committee of the Philippine Pediatric Society. Also joining us is Dr. Rachel Saban Lilin, pediatrician and lactation counselor from the Makati Medical Center. Good evening, doctors. Welcome to the show.
Hi.
August is Breastfeeding Month.
Yes.
And
Yes,
how do
it
we
is.
celebrate Breastfeeding Month?
Well, for pediatricians and for pediatricians in the hospital, we usually celebrate it we try to make it a coordinated celebration with each hospital, especially for PPS accredited hospitals. So we follow the World Breastfeeding Alliance for Action, and this is every August 1 to 7, the first week of August, and we try to create awareness to the public.
You mentioned awareness, and here on MedTalk, we would always want to create awareness and educate our viewers. Now with breastfeeding, so what is the importance of breastfeeding once young or their babies?
There are a lot of benefits that both the baby and the mother can get from breastfeeding. For one, as was mentioned,
It gives the nutrients and antibodies to protect the babies.
Breast milk contains all vital nutrients that a baby needs and antibodies that help them fight diseases.
There are a lot of antibodies present in the breast milk. So it protects the baby from certain infectious diseases, now very commonly diarrhea.
But inasmuch as Cheryl wants to breastfeed, she is having a hard time in doing so.
I have the breast milk naman after 2 days or 3 days, kaya lang sobrang konting-konti talaga.
Determined to give her child only the best, Cheryl sought help from Human Milk for Human Baby. Cheryl hopes that one day she'll be able to give Emerald enough milk, but while waiting, she will do what a mother should do.
Actually,
Breast milk is the best gift a mother can give to her baby.
There are a lot of advantages for breastfeeding, both for the baby and for the mommy. For the baby, basically the breast milk is a complete meal. So the breast milk is full of nutrients that the baby needs, at least for the first 6 months of life. Because during the first 6 months, breast milk is the only thing that is given to the baby.
Sadly, not all mothers are capable of breastfeeding. Cheryl Bernabe Navarro, a first-time mother to Emerald, knows that her own milk is the best for her baby.
number one, according to my pedia nga, breastfeeding not only bond the mother and the child, but most especially yung giving breastfeeding to your child